Hi, my name is Tom Campbell. I'm the chair of the Department of Family Medicine at the University of Rochester, and I'm delighted that you may be interested in doing some research in primary care. And I'd like to offer some thoughts and suggestions for doing research in primary care based upon years of experience working with researchers in our family medicine center over at Highland Hospital. Probably the two problems that researchers tend to get into is one, not appreciating the incredible demands that are currently upon primary care physicians and how overloaded they are, such that asking them to take on a new project, whether it's a research study or whether it's teaching students, it can just put them over the top and may be the kind of proverbial straw that breaks the camel's back. And the second is not appreciating how even very small interventions or requests that are involved with research can be very challenging to put into place in primary care practices and have wide ramifications for the practice that would seem from the outside, without really understanding primary care, can seem like, well, why couldn't you do that? And why is that causing such a problem? So let me tell you a little bit about a typical day in a primary care physician's office. So we schedule patients about every 15 minutes, so that's 12 to 15 patients in a half day. And a typical patient may have 3 to 4 chronic medical problems for which we have a list of quality measures that have to be addressed. That tends to get increasingly long. And then patients may have 1 or 2 acute problems that they also want some advice about. And then add on to that is the long and growing list of preventive measures that need to be at least assessed. And those are, of course, all the cancer screenings, such as the up-to-date with their mammography, their Pap test, their DEXA scan, their colonoscopy, and discussing that with them. Immunizations up to date, or addressing routine screening for smoking, alcohol, depression, or a whole host of other things that have been demonstrated to be effective, but in which there simply isn't time in the day. It's been estimated, in fact, that if primary care physicians really addressed all the evidence-based interventions that are recommended, done for preventive reasons, that it would take 3 times the amount of time that we have in a day to do that for our patients. Add to that the incredible administrative hassles that have overlaid all this, such that we need to get prior authorization for prescriptions, particularly Part D Medicare has added a big burden, as well as now radiology, referrals, and a whole host of things that we have to do outside patient care that adds to the workload. What this all adds up to is that most primary care physicians are overwhelmed in their practices, and many, unfortunately, are burned out and discouraged. And so asking them to add something to it can often be too much for them. But yet many are willing, if approached properly, to participate in research. Let me give you a few suggestions for how to approach primary care physicians, how to work effectively with primary care physicians when doing research. First is to really try to understand both the environment and the culture of a primary care practice. And the best way to do that is to actually spend a half day in the practice, shadowing the primary care physician, working with the staff, seeing about the flow of patients and the kinds of systems that are currently set up that will have to be addressed if one is going to do any kind of research. I think this can be a real eye-opening to see the competing demands, the time pressures that primary care physicians have, and gives you a better understanding of why something that you might want to do is going to be negatively received by either the staff or by the physician. The second is to get input from not only the primary care physician, but also the staffs involved in these practices about any research project that you are contemplating or planning on doing. Get it early, not only in terms of getting valuable input that will perhaps inform the research question that you're asking, but also deal with the issue of feasibility and can it be actually carried out in practice. But equally important to get their buy-in. primary care physicians will not participate in research unless they really feel that they have some active participation, that they have some buy-in to it, that they're being listened to, that they're a collaborator. They're not being used by researchers. There is a feeling among many primary care physicians that there's a tendency for academicians to use them in their practices to do their research, and that it's not a collaborative venture. So therefore, it's important to get input, not only from the primary care physicians, but from their staff, because they're the ones that are often going to make or break whether or not you're able to do the kinds of interventions that you want to carry out. The more that you adapt what you want to do to obviously the flow in the practice, and this is where understanding that flow is critical, is really important. It is amazing how what seems to someone doing research to be a very small intervention, a very easy thing to do, in fact, can be quite difficult to do in the current environment and needs a lot of changes and may need some alterations in the way that you do it before it can be actually implemented. The other thing that always helps is bring food. When you come to talk to the staff, bring donuts, bring lunch. That always brings the staff there and starts them off on the right foot, is useful to break down what I'm afraid still exists, which is a town-gown tension between academic physicians, researchers, and primary care physicians. So it really behooves the researcher to work hard to engage the physicians and their staff members, to make them feel like they are collaborators. Be sure that the project that you're doing is addressing a question that is of clinical relevance to the physician, that they feel like this is something that's going to either help them or their practice, preferably make their practice easier, but at least something that will improve the care down the line that their patients get. They're not going to be interested in studies that are too basic or more academic in their orientation. So I think there are lots of opportunities for primary care to work in primary care and do research in primary care, but it really takes a lot of work to connect with the primary care practices, to adapt the study to make sure that it'll work effectively in primary care. Thanks very much for your time and your willingness to work with us on your project.